Kushta. And there is one Kashaya Yoga mentioned for Vada Kushta. That is practically these lichen planus, tuberculoid leprosy, various forms of leprosy, nummular eczema can be grouped under very dry Kapala Kushtam, and there will be less sweating because of the Rukshatvam of Vayu, and sensory perception is lost. Destruction of hairs will be there. It looks like earthen pot. Earthen pot. See this, it looks like earthen pot, and the appearance looks like pot-like appearance, nummular eczema and tuberculoid leprosy. Now, Udumbara Kushtam. This is Pitta predominant Kushtam. Red colored, pain and burning will be there. Dravya Samanyam, Guna Samanyam, Karma Samanyam. It looks like Udumbara Pala. It is compared with allergic vasculitis. You see, it looks like Udumbara Pala. In allergic vasculitis, the purpuras come like this only. That comes in the lower part of the leg. This is Pittam. Here Pittam is Snigdam. So you have to do a Ruksha Virechana here. So Patola Muladi Kashayam with the Trivrittu Churnam we have to give, or Kalyanaga Gulam we have to give, the Nimbadi Churnam with the Takram Utsadanam we have to do, then Pitta Samanam Rakta Prasadana Tailas like Chambarati Adi, Dinesha Valyadi, Nalpamaradi Karam should be applied externally. Then Pitta Samana Rasayanas like Mahadiktaka Gridam has to be given. Mahadiktagam and Tiktagam are same yogas. Whatever is told in the Tiktagam is present in the Mahadiktagam, but 50% of Mahadiktagam is Amalaki. Few drug exceptions are there. 50% of Mahadiktagam is Amalaki. So Mahadiktagam is a Samana Rasayana Yoga. Tiktagam is usually selected for Achasnagavana for Utkalesana. Now, Mandala Kushtam, Shavanam, Mandalanam, Darshanam, Kapha Kushtam, and white colored, raised circular patch. There will be itching and oozing. It is a tinea variant, fungal infection, ringworm infections are Mandala Kushtas. You see the Shavana, Mandalam, round patch, Dadrugna, Cassia aleta, Sime Agati. Dadrugnam is a very good medicine for Mandala Kushtam. In Kapha Kushtam, we will not select oil. We will be going for Guggulu Diktagam, Kashayam, Guggulu Vanjabala Churnam, Ruksha Utsadanam with Takram with Nimbadi, Virejanam with Trivrittu Churnam or Avipati Churnam. Then we apply externally. Kinvam of Arishta is done for Utsadana for Mandala Kushta according to Charaga, especially of Kadirarishtam, Kushtagara Arishtam. If you select the kinwa can be applied. The acid present in that works like salicylic acid and remove the tinea ringworm. Now Rushyajikvam, it is Vadavittam, red in margin, hard, rough and raised, burning sensation. It looks like the tongue of antelope. Melanoma, skin cancer. Rishyajikvam. Melanoma is a type of skin cancer. Most of the Ayurvedic doctors miss melanoma and tuberculosis of skin. In early part of my career, I missed the tuberculosis of skin. Recently, we found out because of experience and maturity, we were able to diagnose a tuberculosis of prostate. Last month, it was a very interesting experience. It took 7 days for us to come to a conclusion for that diagnosis. Melanoma is a cancer of melanocytes, asymmetry, irregular border, diameter more than 6 red margin. It looks like vein erythematosis in the face, eczema, crackle, discoid lupus erythematosis. We call it DLE, unstable connection. You see this, how it resembles the lotus flower and the face, how it resembles exactly. Pundarika Kushtam is Kaphabittam, Kapham is Snigdam, Pittam is Snigdam. Ruksha Tikta Aushadas are given even in SLE, Tiktarasam, Madhurasam, Kshira Yukta Varesanam, Kshiravasti, Shavanaprasa Rasayanam. That is the protocol, the same protocol that is seen in Vadarakta. Discoid lupus erythematosus is an autoimmune disease. I have already told there are various types of Dadu Dushti, Dadu Vriddhi, Dadu Kshayam, Dadu Bhagam, Dadu Dushti, Dadu Saidilyam, Dadu Asamagatvam, Dadu Stiratvam. These are all the various types. Dadu Stiratvam is our aim. Dadu Vriddhi is obesity, Dadu Kshayam is Rajayakshma, Dadu Dushti is Grahani, Dadu Saidilyam is Pramegam, Dadu Bhagam is Pittam, Vidaktam, Sogunaiki, Vidagatyas Sonidam, that is Raktavittam. Dadu Asamagatvam is Sofam. Dadu Stiratvam in Unmada Nivarti Lakshanam. Dadu Stiratvam, Prakriti Stiratvam is told. Discoid lupus erythematosus comes in the face. When it comes all over the body, we call it SLE. They are, you get ulcers in the lips. Sitma Kushtam, Vada Kafajam. Many people call, we tell Alabu Pushpa Samgadam. It looks like Alabu Pushpa. The doctor will not show Alabu Pushpa and the Kushtha. You should see the Alabu Pushpa first. If you would have seen Alabu Pushpa, then you will be able to compare. Katrika eppadi irukunna Pudalanga madiri irukunnu sonna enna artham? Katrikayum paathadille, Pudalangayum paathadille enna artham. Sidma Kushtam resembles Alabu Pushpam. You see this spherical rough nature of the leaf in Alabu Pushpa, the spherical nature in the flower. You see the spherical nature in the Psoriasis vulgaris. Kagana Kushtam, Tridosham, black and red, ulcer with bleeding, severe pain, severe burning sensation, looks like Gunja, no treatment available, no medicine told. Toxic Dadru separate medicines are told, Mandalam separate medicines are told, Kidipam separate medicines are told. For Kaganam no medicine is told. For Kabalam only 2 medicines are told. Kagana Kushtam, toxic epidermal necrolysis, septicemia. Even now modern medicine, infection in the blood. You see this beautifully, we have collected the photo. You see the Kunja, the black necrosis and red erythema. You are able to see the black and red, that is primary septicemia, Kakana Kushtam, upper precatorius. You are able to see that. Now Chudra Kushtam 11. Yaga Kushtam. Matsya Sagalodbhavam. It is compared with ichthyosis. You see this? Matsya Sagalodbhavam and ichthyosis. Almost they look same. Matsya Sagalodbhavam. Then Charma Kushtam, Gaja Charma Kushtam. Lichen. You see the Gaja and the skin of Gaja and this lichen Simplex chronicus. Kidipa Kushtam, Vada Kapham, atopic dermatitis. Most of the things are Vada Kapha in nature. Vada you have Vada you have Madhuramla Lavanarasam, Pitta you have Tikta Kashaya Madhura Rasam, Kapha you have Kadudikta Kashaya Rasam, Vada Pittam you have Madhura Rasam, Pitta Kapham you have Kapha Pitta Rasam, Vada Kapham you don't have a Rasam, you have a Virium. Vatam is Shidam, Kapham is Shidam, Ushna Virium you have to select. Ushna Virium is against Kushtha, Ushna Virium is against Pitta, Ushna Virium is against Rakta. That is why Kushtam is a Kashtam, Kashta Sadhya Vyadi, because of the principle involved. Vaibhadika Kushtam, Vaibhadikam comes in hand and leg, Pitta Vadi in Suluan Tamil. Adhik fissure dermatitis, traumatic dermatitis in a pere. You see this? Vaibhadika Kushtam. You need more Snigdada, Padam, Ruksha Vriddhi, and Kara Vriddhi. So you have to give Gugulu Diktaka Gradam, Samana Snegavanam before food with Yela Digaram, Satadao Gradam application. multiple time application is needed. Jivantyadi Yamagam is can also be used. Alasa Kushtam is again Vada Kushtam, the Vada Kavajam, this is allergic dermatitis. Dadru Kushtam, it is Kaphavitta Kushtam. It can be correlated to tinea. Separate yogas are mentioned for Dadru in Ashtangradhyam and other texts. Charmadala Kushtam. Charmadala Kushtam is again Kaphavittam. It can be compared to pyodermas. Pama and Kachu. Red black lesion, numerous itching, oozing, seen in buttocks, furunculosis. It is compared to furunculosis. Some people compare to. Comparison is actually not needed. The dosha, avastha, guna dushti is needed for the treatment. But because of the academic work we are doing, we have made a near possible comparison to take her to the next level. For a treatment purpose, ancient Vaidyas like my grandfather, they were not comparing. Actually, it is not needed. If you know, you will not miss like the skin cancer, skin tuberculosis, etc. Cutaneous manifestation of systemic disease. The problem may be in the hypertension. It will be a polyarteritis nodosa. You may miss that cutaneous manifestation. Vispodum is a separate chapter. Or vispodas are the chicken box is a vispodum where you will be giving chandana parpadagadi kashayam, amrita shadangam kashayam, sudarsana vadi, tikta samana sida viri aushadas. Here you should not go for bugulirikagam. You should go for shadangam without shundi. You have in that. That is called the amrita shadangam. External application is contraindicated because they are kleda yukta vyadis. Vispodum, folliculitis, Sataru, Kaphavittam. So that is the slide. Vicharchika, back to the old one. Vicharchika is a Kevala Kaphakushtam, that is eczema. One minute, please. 1 minute. It is taking time.
No problem, sir.
1 minute, please. Forgive me.
Yes. No, sir. No, sir. It's always our privilege waiting for you in class.
What do you screen? Okay. So be quick. Be patient. Next.
Kushta Chikitsa. Kushtinam Snegavanena Purvam Sarvamvajare. Arunadatta says Snegavanena Purvam. When you see Purva Rupa Avastha itself, you should have started Snegavana. That is the meaning of the word Purva, not first. So when you see the Purva Rupa Avastha itself, you should start Snegavana. Then the question usually asked whether you need plain ghee or medicated ghee for Snegavana. Dalgana says Samskritam va. Then Chakravani says Mridurnasye Kare Abhyenge Vastavabhanav Chikkanaga. Agni Samskaram is told. If Agni Samskaram is not told, then how Mriduvanasye Kara Abhyenge is there? In some schools like in Udupi, North India, they do with plain ghee also. And in our tradition, we do with medicated ghee because 22 Gridas are told in Kushta Chikitsa. If it is a non-medicated ghee, Tiktagam, Mahadiktagam, Vajragam, Mahavajragam, Arakvada Mahadiktagam, Durvadi Gridam, so many Gridas Gukul would not have been told. So Vadam Sarpi, Pittam Raktamokshanam, Ruksha Virejanam, Snigdha Virejanam, Nimbamrada Erandam, Vadaraktam, Sukumara Erandam, Pumsavanam, Nirgundi Erandam, Gridrasi, Sakadevi Erandam, Jwaram. So Ruksha Virejanam, Padola Muladi, Ruksha Virejanam is divided into three. Uttama Ruksha Virejanam, Madhyama Rukshama Virejanam, Hina Ruksha Virejanam. Padola Muladi is Uttama Virejanam, Shatratra Prayogad. Padola Kaduro Ginyadi, Madhyama Virejanam, Vasa Guluchiadi, Mrudu Virejanam. So Uttama Virejanam, and in I told about Vada Kafajam, Vada Kafabhyam Kruraha. Vada Kafam is Krurakoshta. So again in Krurakoshta, Snega Basti is indicated. Krurakoshtam and Atyagri. So Kafam we do Vamana. Rukshana. Kashayam for Rukshana in Kushtam. For suppose Tamaka Swasam we want to do a Snegavana. We will be doing Pachana can be done with Tikta Pachana, Kadu Pachana. Tikta Pachana in Kushtam we have to do Tikta Pachana. In Tamaka Swasam we will be doing Kadu Pachana. How will you do Kadu Pachana? Indgandham, Tirgadu, Panchagolasavam, Takrapanam, not Takrapanam. So this comes under Kadu Pachana. In Kushtam we will be doing Tikta Pachana. How will you do Tikta Pachana? Amrudotaram, Shaddaranam, Guduchadi, Amrita Vrishapadoladi. Tiktabadanam is needed in Kushta. Kadubadanam is needed in Tamaka. Both are Vada Kapha Rogas only. Then Shurnam, Sudarsanam, Shaddaranam, Gugulu Banjavalam also can be used for Rukshana. The patient with Kushta should be treated with Snagavana Gridam. Only one Gridam is told. Desamula, Amrita, Air Chargeshta, Meshasringi. Vada Kushta. In all neuropathies, I am giving this medicine as Thailam and Kashayam. I am getting very good result. This is used as Uddvartana, Thaila, Anuvasana, not Anuvasana, this Thaila Prayoga, internal Grida. Bashpa Swedam is indicated. Swedam is contraindicated in Kushtam. Just for Utklesanam it is indicated. Then Vamana, Madana Vala Yoga, Madana Valam, Vaja, Yashtimadu, Saindavam, or Siddharthaka Snana Yogam you can do. Virejanam, Trivrita Jurnam, 20 grams at Kafa Jirna Galam, morning 9 o'clock only you have to give Virejana. Avipati Jurnam, Kalyana Gulam. Kalyana Gulam does not contain Gridam, it contains Diladailam only. It is a Pumsavana Visesha Yogam, Stri Pumsavana Visesha Yogam. Manivatra Gulam, Nimbamara Yarandam in conditions like psoriatic arthropathy, where Vada's involvement is also there. Nasyam Triratrad Nasyam Shiro Virejini Ganam Yashtimadu Dailam Tovaraga Dailam for Nasyam for 50 days. Sneganam. Acha Snegavana is done with Diktagam, Mahadiktagam, Guguli Diktagam, Aragvada Mahadiktagam, Vajraga Gradam, Balladaga Gradam can be used as Samana Snegavana. 30 ml is the maximum dosage for Balladaga Grada once daily. Importance of Snegavana. Kledam Samayotam Prayogena Sugamva Koshtamanaye Nyatva Koshta Prabannancha Yadasannam Minirkare. So you have to bring back from Saga to Koshta with the Abhishan, the Bhagam, Maradhanakragam, Srodom, Vishodanam. Kushtam Swedam is contraindicated. But Stiragadina Mandala Kushtana, totally Hida Swedaye. In Stira Kadina Mandala Kushtam, lichen planus, Arakvadadi Kashayam with Sashtikam can be made into botany, and Balava Guduchiadi Eladi Garam is applied, and Swedanam can be done. Very good effect is seen in chronic lichen simplex. That is the only condition where Sodanam I have done practically in Kushta. Psoriatic arthropathy, Bashpa Swedam, we will be doing. Sodanam, 15 days Vamanam, 1 month Virejanam, 3 days Nasyam, 6 months Raktamokshanam. Panchadikta Vasti, whether Vasti can be given to Kushta. In Chakradatta, in Vasti chapter, last verse is Avastam Prapi Nirdishtam, Kushtinam Vasti Karmaja. That is what your Avastas are demanding. Even in Kushta, Vasti can be done. Vasti can be done. And the Vasti in psoriatic arthropathy, we will be giving Panchadikta Vasti. Machikam, Lavanam, Snegam, Dikta Gradam, Kalkam, Sarshabam, Panchadiktam. So many Panchadiktas are there. In Vaishyacharatnavali, in Jora one Panchadiktam is there. In Gugul Diktagam, Nimbam, the Vrishapadola, Nedik Diganam, that Panchadiktam is there. In Charagam Dikti, Padola Nim, Babunim, Rasana, Saptachada, Rasana, how they included in Diktam is questionable. One Panchadiktam is there. Total quantity is Padaginam. Padaginam is 900 ml. Nasyam. Tuvaraga Daila Nasyam. In Tuvaraga Daila, Tuvaraga Rasayanam, Nasyam is Smridivardhanam also. This Tuvaraga Nasyam. Shamana Chikitsa. After repeated Bahu Sodhana, you have to do Shamana Chikitsa. Kashayam, Churnam, Gridam, Vadi, Asavam, Arishtam, Legium, Thailam are used accordingly based on the Avastha. Pada Samana Kashayam, Tasamula Amradadi Kashayam, only one Kashayam we have. Nishottamadi Yogam, Grida Yogam, all the Kashaya Yogas are converted into Grida and can be given in Padakushta. Pitta Samanam, Padoladi, Shatratra Prayogam, Anuvanam is Jankala Mansam, because even they in conditions like Fimbicus vulgaris, hypoalbuminemia will come, hypoproteinemia will come. Once you give mamsarasam as anubanam, this will not happen. Padoladi, Padola Kadaroginyadi, Mahamanjishtadi, Mahadiktakam, Nimbadi, Tiktakam, Panchadiktakam, Manjishtadi, Sonidamradam, Sariva, Haridagi, Nimba, Vajrakam, Chandana Varpadagadi, Trayandyadi Kashayam, which contains Masuram, Gridam is Prakshepam, Navagarshikam, Sakasrayogam, Vadarakta Pragranam are given. So many Tiktarasa choices, and there Samanya Palasruti is there, Vishesha Palasruti is there. Mahapanjishtadi Tiktarasam, Rukshagunam, Sidaviryam, Pittasamanam, Kapasamanam, Kushtarogam, Samanya Palasruti. Vishesha Palasruti, Vadaraktam, Pakshagada. That you have to understand. So many Chandana Parpadagadi is given in chicken box, Vispoda. Kapasamanam Gashayam, like Vicharchika, Amrudottaram, Arakvada Amrudadi, Amruda Rajanyadi, Arakvadadi Ganam, Kushtagana Kashayam, Charaga, Gukulidiktam Kashayam. How Gukulidiktam can be converted into Kashayam? Varunadi can be converted into Kashayam. Varunadi can be converted into Gridam. Varunadi can be converted into Arishtam. Because Varunadi is a Ganam. How can you convert Yogam into Kashayam? But Vaidyas have done that. Aptavakyam we have to do. Reason for contraindication of Thailam. Thailam is Tokdoshakaram. Thailam is Ushnasniktam. So Thailam is not selected for Snegavana. Even external coconut oil caram preparations are more useful. So Samana Ushadas. Gridam for Vada, Nishotamadi, Amrita Balladagam, Pittam, Panjadiktakam, Durvadi. Kafam, Guguladittakam, Mahagadiradi, Vati, Vadam, Arogyavardhini, Pittam, Kaishora Gugulu. Kaishora Gugulu, the main ingredient is Guduchi. Second ingredient is Trivrut. Guduchi and Trivrut are Pitta Samana Yoga. Kaishora Gugulu is the only Gugulu for Kavala Pitta. Then Amruda Gugulu. Kafa, Kandakarasayana, Saptasama Puliga. Saptasama Puliga contains Balladagam. Narasimham contains Balladagam. Kankayanam contains Balladagam. Dhanvantara Kridam contains Balladagam. Gukulidiktam contains Balladagam. Bagushalam contains Balladagam. For Balladagam and Tuvaragam, Ushna Jalam is contraindicated. Aval Guja Bijadi Guliga, Gukulu Banjavala Guliga, Trifala Gukulu, Vilvadi Guliga are for Kafa. Arishtam, Chitrakasavam for Vada, Pittam Arishtam is not given, but Sarivadi Asavam, Vaishitaratnavali, Pramega Padagadigaram, Parpatagasavam, Kamala Visheshatam, Sudarsanasamam, traditional Sudarsanam, the main ingredient is Bunimbam. 53 ingredients are there in Sudarsanam. Sudarsanam we are trying for COVID. Excellent results are there. Excellent mean excellent. Aravindasavam. Aravindam contains lotus. Two types of lotus are available. One is white, another one is red. For Manorogam, white is selected. For Raktadushti, red is selected. Ushirasavam, Raktavitta Pragaranam, Vaishacharatnavali. In Kafam, Kadararishtam, Arakvadarishtam. In Arakvadarishtam, there are two preparations. Some people use Arakvada Patram only. Some people use Arakvadadi Gana, Amrudadi Kashayam, Mulagasavam. Many people think Mulagam is radish. Mulagam is Madhusnuhi here. Nimbamradasavam, that is Gugulidiktam converted into Asavam. That is Nimbamradasavam with Balladagam and Gugulu. What is slide? The slide or a room, but time. Lehiam, Brigat Madhusnuhi Lehiam, Pittam, Trivurt Lehiam, Kalyanaga Gulam, Kafam, Amrita Balladagam, Churnam, Vadam, Shattaranam. Shattaranam is called Chitragadi Kashayam, Palasya Dasamo Bhagaga Dharanam. Shattaranam is Mahavada Vyadi Prasamano Yogaga. Mahavada Vyadi is Vadaraktam. What is given in Vadaraktam can be given in KUSHTHA. Amaseka Vada, Shattaranam is told. Sudarsanam Nimbadi for Pittam. Madhusnigi Gandhagam Haridra Gandam for Kafam. Gandhaga Basmam for Vadam. Pravala Basmam for Pittam. Rasamanikyam, Haridalam, Talagam, Rasasanduram for Kafam. For Rasayanam, Pitta, Manivadram, Kardada, Kadira, Gudusi, Eshtimadu. For Kafam, Chitraka Rasayanam, Takram, Gomutram, Gandhaka Rasayanam, Balladaka Rasayanam. We will see elaborately if time permits. External therapy. Vadajam, Dasamula Amrudadi Dailam, Balaguduchiadi Dailam. For Pitta external, Shambaratiadi Geram, Dineshavalyadi Geram, Pindadelam, 8 to 9 types of Pindadelam is there. Pindam means it attains Pinda. Recently I read a commentary, the word Pinda means Sarjarasa. Recently I read in Venkata Subramanya Shastri's commentary, I have read Pinda means Sarjarasa. Madhu Yashtiyadi Tailam, Panchavalkaladi Tailam, Jati Pushpadi Tailam, Kafam, Keladi Ganadailam, Tuvaragadailam, Marijadi Dailam, Vaishajaratnavadi, Sutra Prakaranam, Vajragadailam, Gandagadailam, Surasadi Ganadailam. Surasadi Ganam is Kledanasanam. That is why in Premega Chikissa starts with Surasadi Gana Basti. Dadu Saidilyam, Surasadi Gana Basti is given Levam, Shishiradi Levam, Sweta Karavira Levam, Nimbadi Levam, Rasotamadi, Aval Bujadi, Snanam, Trifala, Snanam, Nimbam, Snanam, Nalpamaram, Snanam, Siddharthakam, Snanam, Nimbadi Jurnam, Trifaladi Jurnam, Udvartanam, with Takram, Prachane Alpake Kushte, Prachane Sirabirva, Desa Deshandram Braje, Alpatosha and shifting nature, multiple Shodhanas are needed. Sringa Raktamokshanam, I have not done. Jaluga, Ruk Raga Tota Dageshu Jaluga be Vinirhared. You can give Jaluga, local effect, not very effective treatment in systemic skin diseases. Prachanam, already I told. Vadaraktam, 50% of the treatment is Raktamokshana. Because Raktam, Vada Raktam, that is. Vadam, Sringam, Pittam, Jaluga, Kafam, Alabu. Shara yogas are applied in the case of Prasupti. Daiva Vavasaraya Chikissa is very important in Kushtha. One has to do Guru Seva and obedient pray to Shiva Sudadaraga. In some textbook, Jina Sudadaraga. Shiva Sudha can be Muruga or Ganesha, Tara, Kamakshi, Bhaskaraga Aradhanani, Surya Upasana, as told. Venkata Subramanya Shastri has written Shiva Sudha only, but in some book, Jain, the Buddhist tradition gods are mentioned, all adhering to the vows, controlling emotion, all achara rasayanas. You have to follow, respect Yamaniyamas. Actually, Yamaniyam, because in Manipatra Gudam, they use the word Jidatmanaga. Then, while telling the Panjamula se Datriva, Reso, Leli Dagi Vasan, they telling you should live the life of a Yedi. So you should live like a Rishi to control Kushtha. Who will live like a Rishi? The cutaneous manifestations of systemic diseases mentioned in Ayurveda. Uttana Vadaraktam, scleroderma, Raktadiga Vadaraktam, Tamravarnam, SLE, Pittadiga Vadaraktam, pseudo-gout, Raktavrada Raynaud's phenomenon, Damari Anguli Sandinam, Sankojam, Sida Dvesham, Anubasayam. How beautifully Raynaud's is told. You cannot explain Raynaud's in a better way other than this. Sida Dvesho, Anubasayo. If you put a hand in the cold water, your hand will become blue in color. Raynaud's. Vada Jwaram, rheumatic fever, Erythema nodosum, told in Ayurveda, Rakta Grandhi. Pittacharam, leptospirosis induced icterus changes, Rakta, Koda, Udgama, Pida, Haridatvam, Tok, Adishu. Kafajwaram, bullous lesions are told in Kafajwaram. Vadabandu, pallor is told, cutaneous manifestation. Pittabandu, hemolytic anemia. There are two Pandus, Rasapandu, Raktabandu, Susrudabandu, Charagabandu. Charagabandu is Pittabandu. Pittabandu is Saidalya Bandu. Dadakshayam, Sarakshayam, Vodakshayam are seen in Pittabandu. Pittabandu, Vasa Guduchyadi, Kafabandu, Punarnavadi, Gomutra Haridagi. So Kamala, non-obstructive jaundice, also you will see the Haridra Varnada. Halimagam, hepatic encephalopathy, Vadasofam, cardiac edema, you will be seeing in Vadasofam, Pittasofam, inflammatory edema, Kaphasofam, renal edema, Raktabittam, purpuras, ITP, idiopathic thrombocytopenic purpura, it is Raktapitta, Vasa Guluchya Kashayam, Vasa Kridam, Kalyana Gapulam, Virejanam, Shadanga Vaniyam. 1 year you have to take. 1 year if you take, there will be improvement. I tell you. 1 year. Then Mahadiktakam Samana Snegavanam for 6 months. Morning 12:30, evening 5:30. Acanthos is Nigerians. See, it is a skin disease you think, but it is due to Kapha Pramega. Pramega Pururuvani. Scleroderma. You see the hump in the back. Trigangrene. Diabetic dermatopathy, dermopathy. Diabetic microangiopathy, Arakvadadi Kashayam, Triphala Gugulu, Nalpamara Dara, Machika Thailam Pichu. You will be all right. Arjuna Rishtam, Yanena Rasadadurgi, Vichev Bochida Karmana, Yugava Sarvada Ajasro, Dege, Vichipya Desada, hyperhidrosis, PCOD, insulin resistance, testosterone level is high. Erythema nodosum, tender nodule with pain seen in rheumatic fever. Connective tissue disorders and in sarcoidosis. Liver disease also you have skin manifestation, jaundice, palmar erythema, purpura, spider angioma, pruritus, lichen planus in hepatitis C. Jaundice, palmar erythema, redness in the palm. Jaundice, cirrhosis it is seen, purpura, spider angioma, central nodule with capillary spreading like spider, come in the trunk, hands and face, lichen planus, oral lichen planus. In renal disease, skin will be affected. Cirrhosis, itching in the skin, severe itching in urea is increased. Malasanchayam, malam is kapham and pittam, vadam is not malam, kapha pittam malam keshu prasvedo nagaro maja, netra vittochu snego dadu nam kramaso mala, perforating folliculitis, nephrogenic systemic fibrosis, off and off nails, you can see in chronic renal failure cases, xantholasma, this is in hypercholesterolemia also. Diabetes mellitus, we have seen that. Candid infection, common in diabetes. Immunocompromised state. That is why in COVID we tell liver patient, BP patient, diabetic patient, cancer patients to be careful. Diabetic neuropathy, foot ulcer, Charcot foot. Diabetic carbuncle, Pramega Pidaga, Jalini, Vinada, Putrini, all these Pidagas. Pidagas told in Ayurvedas are various stages of diabetic carbuncle. Various stages of manifestation of diabetic carbuncles is Pramega Pidaga. Pramega Pidaga is a separate chapter. Shadakshinam is a separate chapter. Skin manifestation in rheumatoid, what we see every day. SLE, malar rash, differentiated from rosacea. Raynaud's phenomenon, see the blue cyanotic tip. Psoriatic nail changes, sausage digit and arthritis mutilans. Dactylitis. Rheumatoid nodules. Skin changes. அடுத்தது யோகாஸ்.
Wells of yogas.
Now we will see the yogas mentioned in KUSHTHA based on Guna Siddhanta, how to select a medicine in clinical practice. Then I have Rasayanas in KUSHTHA, Tuvaragam, Chitrakam, Balladakam. Then I have case studies. Probably we need another 3-4 hours to finish everything. I will talk about yogas and stop the class because yogas are very important. Shudra Rogas, I have got some 100 slides. We have documented all the Shudra Rogas into beautiful photographs. Tiktam, Sodana Tiktam, Samana Siktam, already I told. So, Pittakara Kashayam, Manjishtadi, Mahamanjishtadi, Mahadiktakam, Kafakaram, Amrudottaram, Nishottamadi, Kukulu, Sivana Vembu. It's a very good medicine, Tamil medicine. References are not available. Then Kasamartham for itching, Cassia group, Pitta Samana Gradam, Kapha Samana Gradam, Kapha Pitta Samanam, and Kapha Samanam. Mela Marakara the day.
Okay, we'll continue also. I'll automatically.
Valiya Madhusni Rayam for Kapha, Amrita Balladakam, Gugulu Valladi Legium, Gugulu Balladakam. Lebam, Kunkumadi, Rasakarpuram, Tuvaragalebam, Sindhuvaralebam, all Kafagara. I have written commentary for Sakasra Yoga in English. So how I have written the indications of Tiktaka. Pittaja Kushtam, like, so I have translated, like erythema nodosum cellulitis recovery. Recovery, that is Nirama. Parisarpam, herpes vesiculobullous lesions, recovery. Pidaga, bacterial carbuncles. Dagam, broad spectrum sensory neuropathy group of disorders. Trit, everybody will translate as thirst. I translated Trit, dehydration, recovery, and electrolyte imbalance. The Saragunam, Dravagunam of Pitta. Based on that, you will be able to talk about sodium and potassium, acidosis and alkalosis. Somebody asked me when in a foreign country, you are talking about Pittam, whether your Pittam you are talking is acidic or alkaline. I told Vada by Guru blessed me, Vadanubandha Pittam is acidic, Kafanubandha Pittam is alkaline. So then they were very happy. Brahman, vertigo, dizziness, complex, Kandu, pruritus spectrum, Pandu, metabolic syndrome including anemia, Dushta Nadi Vranam, bad sinus ulcer, Apaji, cervical lymphadenopathy, maybe due to DB, maybe due to Hodgkin's, maybe due to non-Hodgkin's, we don't know, Vispodum, folliculitis, Vidradi abscess. Now you see Gulmam. I didn't translate. Gulmam is Gulmam only. You cannot translate Gulmam. You cannot translate Udavardam. So I kept Gulmam as Gulmam itself. There is no translation available in my book. Phantom tumor and all. I don't write because I have not clinically experienced that. I am a clinician. I take classes after treating 5 to 6 lakhs cases. Sopham, edema, Unmadam, psychosis, Madam, alcoholic intoxication, Hridrogam. I have written Vada Pitta type of cardiac disease recovery. Hridrogam is not a Maharogam. Hridrogam is not a Maharogam. Now Hridrogam is a Maharogam. Hridrogam number of slogas are very less. Number of slogas are more in Jwaram. Number of slogas are more in Kasam. Number of slogas are more in Rasayanam. Number of slogas are more in Gulmam. Number of slogas are very less in Vadaraktam. Hridrogam, boy. Prevalence. Timiram, type of ITDs, Venkam, Melasma, Gragani, IBS, Crohn's. In Gragani, Tiktaka Gridam, I wrote Crohn's, Pitta Gragani. Switram, hypopigmentation, vitiligo, Kamala, hepatitis spectrum, recovery, apasmaram, temporal lobe epilepsy, because that is Pittam. Vada apasmaram is tonic, clonic, Pitta apasmaram is temporal lobe, Kaphasmaram is partial seizures. Udaram, cirrhosis with portal hypertension, second stage. Udaram is an extension version of portal hypertension. You have Vada Udaram, heart failure, right heart failure, Pittodaram, peritonitis, Kaphodaram, cryptogenic cirrhosis, and except these Parisravi Udaram and Chitrodaram, all Udaras denotes various forms of cirrhosis, portal hypertension, and ascites, either cardiac origin or liver origin. It's beautiful. Beautifully it is told in the text. Garavisham, Arshas, Asrapittam, Krichran, Pittadan, Gadan. We have to study so much. Arakvada Mahadiktagam, Arakvadadi Ganam, Mahadiktagam, Kalkam. Brahmi Gridam, Visheshapala Sudhi is 3 Pumsavanam and Kushtam. Up to 4 Pala Samana Chinagavana, 200 ml we can give. It is Pittasavanam Kushtagnam. Kushtaganadri 50 Ganas of Charaga you should study. Trifala, Vadasamanam Jatushyam, Pittasamanam Jatushyam, Kapasamanam Jatushyam, Vadasamanam Jatushyam, Vibhidaki, macular degeneration, Pittasamanam Jatushyam, Amalaki, retinitis pigmentosa, Kapasamanam Jatushyam, Haridagi, glaucoma, Kushtaganaganam, Vadasamanam Kushtakanam, lichen planus, Valladagam, Pittasamanam Kushtakanam, Erythema, Nimba, Kapasamanam Kushtakanam, Eczema, Vicharchika, Arakolam. Like that, Brahmi Gridam is Pittasamanam Kushtakanam. Talepe Teriyamatanga. Gugulidikta Kridam. It is given in chronic deep-seated Kaphavada disease. Gugulidikta contains Palladagam. Ushnajalam is contraindicated. Highly useful in psoriatic arthropathy. Jivantiyadi Yamalam. Yamalam means Gridam and Thailam. Sadadauda Gridam for burning peripheral neuropathy. Vajraga Gridam, Tikta Shida Gridam, Samana Yogam. Vajraga Gridam is available in the market. Mahavajragam, Krura Koshtam it is given. It contains Nigumba, Snugi, very difficult to prepare. Nobody is preparing. Vajraga Thailam also, nobody is preparing. It is contained Arushkaram, Indravaruni, again Kadurasam, Tikshnam, Snugi, Arkam, Mahavajraga Gridam. They are given for vitiligo-like conditions. Leukoderma, the word you should not use. Vitiligo is the correct word. Daily the Vasa, Gandagam. With Irinalli Karpam in Siddha they say that is Gandagam with Amalai. Vaidyanas are used to tell the sloga. Panchamula se Datriva, Daso Leli the Vasan. Padola Mola Kashayam, Tikta Shodana, Arakvada Amudati, Kashaya Tikta Rasam, Pitta Samanam, Samana Kashaya, not Shodana, Arakvada Amudadi, Kashaya Rasam, Tikta Anurasam, Sida Viriam, Pitta Haram, Ruksham, Arakvadam Amrda Patya Kadira, skin disease, Pimpicus eruption, eczema, cellulitis, Prakshevam, Amrda Guguru, Sandana Varpadagadi, Tikta Rasam, Sida Viriam, Pitta Samanam, Vispodakaram, given in measles, chickenpox. Manjishtadi, pitta shamanam, kapha pittakaram. Nishottamadi. Nisha Uttamadi is kapha pitta shamanam. Uttama means triphala. Panchadikta kashayam, that is Nimbamrita Vishapadola Nidiktigana. Padoladi Gana, Padola Kadarogini Chandanam, Madhusrava Guduji Vadan Vidam. Hepatocellular jaundice, eczema, psoriasis. Original Kadarogini is 6,000 rupees per kilo. Vidangam, Amalagam, Abaya, Palatrayam, Trini Balani, Kumban, Masameva, Jidatmanaga. 1 month you have to like Manivatran is the name of the action. Bagusalam is the name of the action. Ramana Maharshi has written a beautiful Tamil Venba about Manivatra Kulam. Yenadu Ninaivalaigal, a book written by Kunjuswami. If you read that book, Yenadu Ninaivalaigal, Kunjuswami's life with Ramana Maharshi. Ramana Maharshi from Kanjivaram Narayana Vaidyasalai, Manivatra Kulam was sent to Ramana Maharshi. Then Ramana Maharshi, after hearing the yoga, prepared the medicine and wrote a beautiful Venba, Tamil poem on Manivatra Kulam. Recently I read that. I wanted to buy her, but because of the age nowadays I am unable to buy her. Madhusnigi came into India by 16th century end only. It is Vadasamanam, Rakta Prasadana Ushada. Madhusnigi, Gandagam, Madhusnigi, Gugulu, Madhusnigi, Balladagam, Asavas and Arishtas. Aravindasavam, Pittasamanam, lotus can be given for children's disease. Arakpadadi Arishtam, Kafavittasamanam. Gomutrasavam, otherwise called Chitrakasavam, Switram. Mulagasavam, Mulagam is Madhusnigi. Surasasavam, Krimi. Kushirasavam, Thailam. Anudelam. 2 anudelas are there. It contains goat. Goat's milk, nourishing. It is Pitta Samana, Nitya Upayoga. Anything that is used for Nitya Upayoga cannot be more Vyadi Pratiniga in nature. Anudelam is Pitta Samana Nasyam, Palidam, etc. All Pitta Samana Nasya only Anudelam is selected. Asana Yeladi, Asana Vilvadi, Asana Manjishtadi. Asana Yeladi, Kafam, Asana Vilvadi, Vadam, Asana Manjishtadi, Pittam. Vringamalagam, Keshyam. Dineshavalli plus Saduchiri. Durvadi, Pittasamanam, mild medicine, mild. Durdurapatradi, Yeladi, Dineshavalli, Vetpalai are used for psoriasis. Guggulu Marijadi Delam. This is called Aditya Bhaga Delam. It is prepared in sunlight. No heating is there. It contains Haridalam and Manosila. It is useful in lichen planus. Kungumadi Delam. Very costly. Nimbamar Yeranda. Guggulu Dittakam processed in Yeranda Delam. Parandiyadi Keram. Tetti Pushpadi. Diabetic ulcer, Masikai, West Marinde. These some of the medicines what we use in our hospital for ringworm. Baguji, Sangangupi, Chutra Agnimanda, Krishna Jiragam. We use for fungal infection. Mandala Kushtham, we use Kuppai Meni, Mardala Mohini with Baguji. Brahmadandi, Arkam, Chitrakam, Madayandiga, Tuvaragam. We give for wart, Lekanam, Kadurasam, Ushnam, Tishnam, Kushtakaram. Sangangupi for fungal. Sangangupi, Kuppaimeni, Vellarig, Aviri, Nilini, Nagajifa, Haridamanjari, Shudra Agnimanda. These are Tamil Yogangal. For corn, Kadaram, Erik, Arkam, Amman Pacharisi, Shirini, Chittarapala, it is called Chittarapala Dai. Ung Karanjam, Penduli, for Switram we give Paguji Tuvaragam Arakvadam Haridra Narigelam Arakvada Patradi Lotradi for pimples. Shattaranam already I told. Dasangam Guliga, Vilvadi Guliga, Dushi Vishadi Guliga are all are Vadakamasavanam in nature. Both are Ushnaviryam in nature. Gobi Jantanadi Guliga. Gobi Jantanam is a type of clay available in Narmada river, but we do not use that now. Gobi we take Shariba, Chandanam we take Chandanam. That is how Gobi Jantanadi is made. Kaisora Gulu, Patural, then you go to the Kshutra Kushtas, 5 minutes. I will take 5 minutes only.
Yes, sir.
2-3 hours material is there, but people will be bored. So I will finish it.
No problem, sir.
Share. Okay.
Sutra Rogas, we have done documentation. Even big institute, they could not do a visual diary for Kushtas. Just I wanted to show you.
Okay, start.
Ajagalliga, suppose Ajagalliga is there, it looks like Mudga. So Mudga we show, Ajagalliga we show. Ajagalliga Chikisa. Yava Prakya, it looks like Yava. Then modern comparison. Yava Prakya, calcinosis cutis. Neurofibroma. Kachabiga, neurofibroma, the shell of tortoise, neurofibroma. Like this, we have got some 200 photographs. There is no time. Already I talked for 2 hours. I thank Krishna Kumar ji, Vinod ji, Principal ji, Chandramouli Suran, my old student,